Hi everyone. So, preschoolers, that means children of the age of 3 to 6 years of age. Now, is there any special method or special technology that has to be sought for when we are taking care of their oral health? Yes. The answer to this is yes. Because every age group is different. The ability of every age group is also different, which is why the support and the method and the points that are to be kept in point, the methods that are to be kept in mind for the oral care of preschoolers, as we'll be discussing today, will also be different. Now, see, the thing that we see in children as they reach the age of 3 is that they start becoming more independent and they start becoming more interested in doing their things on their own. Now, when it comes to brushing, also, you will see that they'll be more interested in owning the act. They'll be more interested in doing it themselves. They will not want you to take their toothbrush and brush their teeth. In fact, they would want to do it on their own. The second thing is they develop expectoration. That means they are able to rinse their mouth on their own, right? Then the third thing is they'll be more dexterous. That means their manipulation, their maneuvering with the toothbrush also improves. Which is why a parent starts thinking that now my child has started liking it and doing it on his own, and he has started to expectorate on his own, and he has got better handling of the toothbrush now. That means my involvement or my supervision is not necessary. But that's not the answer. See, although the child has developed all this skill set, I should say, or has started to develop this skill set, this does not exclude your intervention with their activity of brushing their teeth. Your intervention and you brushing their teeth is still required and is still needed, I should say, and parents must continue brushing their teeth. Yes, the one thing how you can make it fun for them is, or allow, or like make it more handy for them to let you do it, is you can let them do it once for their fun, and then you can say that now it's my turn, let mama do it again, right? Or it's daddy's turn, let's daddy do it now. So that is one thing. That means the parents must continue brushing their children's teeth. Okay. All this skill set in your child does not exclude you from staying away, or does not exclude you from brushing your child's teeth. Now, the first thing first, fine. Now the parent has to still intervene and brush their teeth. That means now the first thing is, how are you supposed to stand with your child? So what has to be the position? Now, there are two positions that I've showed on the screen. The first position is wherein the parent and the child are facing the same direction. That means both of them are facing the mirror and they're standing in the same direction. Now, in this position, what is happening? The child's head is rested on the parent's or the guardian's arm. So you have a proper head support and you're doing the basic horizontal motion. We'll come to it later, what motion is required of the toothbrush. So you are brushing it. So in this way, your child has a head support, and this is a better way of you positioning your child for brushing their teeth. In contrary to the picture that is shown down, see here both of them are facing each other. Might seem pleasant, but see in this position it's quite awkward, because it's fine when you are brushing your child's front teeth. What about when you are brushing the back teeth or the molars? At that time you will ask your child to open their mouth, put your head up. In that case the child will not have a head support, which is extremely important because the child is still very naive at this point, right? So you have to be careful of the position. It's extremely important. So the position in which the parent and the child is facing each other, you can do it, but it is not encouraged. Okay. Then comes the point, how much of the toothpaste is to be taken. See, I've already mentioned in my previous video, I'll put the link of that in the description box, wherein the child is younger to this. That means in toddlers, what is the amount of toothpaste? When the child comes in the age of preschool, at this time you have to use a pea size of the amount of toothpaste, just as it is shown in the picture. Because see, no matter the fact that they've started expectorating, but they have not mastered the skill of expectorating, and it is fine, it's not harmful, but it's not suggestible also for them to have certain amount of toothpaste in them. Like, it's better if we can avoid it, which is why it's always prescribed to take a pea size amount of toothpaste, because that much amount of toothpaste will be utilized in brushing their teeth, and the less of it will be left for them to ingest it. So that is why take a pea sized amount of toothpaste. Then comes the question of what strokes. That means how should you move your toothbrush around in your child's teeth. Simple horizontal scrubbing motion, right? Just left, right. Do not go into those tedious, highly skilled, dexterous brushing techniques. All that is not required, because the children of this age have got very small teeth, have spaces in their teeth. Spaces in their teeth provide their teeth to be self-cleansing, make their teeth to be self-cleansing. So all that technique is not required. Only smooth horizontal scrubbing motion is required for their teeth to be healthy and fine. Then most of the parents ask me if flossing is required. See, as I already mentioned, the teeth of your children at this age group are milk teeth, and these milk teeth in most of the cases have got open spaces. That means they have space in between their teeth. These open spaces are self-cleansing. The saliva can go and come through this space and it cleans the space. That is why flossing is not required. Only in the last molar that you see, a tight contact is present between the first and the second molars. That means those last chewing teeth that you see, the contact is only at this point. If you want, you can clean the contact at that point just once with whichever kind of floss you want, either the threaded ones or the handle ones that you get in the market. Whichever one is easy for you, just use it at that point once before sleeping after brushing your teeth. That's enough. But in those patients or in those children where the contact is very tight amongst the teeth and there are fewer open spaces, then in that case, yes, I highly recommend that parents should floss their children's teeth if there is no open contact or if there is tight contact between all the teeth. Yes, they do seem to be very sightful, properly arranged pearl-like teeth with tight contacts amongst each other, but at this age, open contacts are favorable. As I've already mentioned, it makes the teeth to be self-cleansing. So, an extra step of flossing your child's teeth when they have tight contacts between the tooth is needed. Okay. Now, another question is, should fluoride gels and rinses be needed? That means, should we use fluoride gels and fluoride rinses in our children of the preschool age? See, the answer to this will be avoid it. Avoid it if you are doing all the basic oral hygiene measures. It's not needed. But if your child has got a very high or a medium risk of caries, that means you see that my child is more prone to getting their teeth cavitated, then in that case, yes, you have to go a step further and have to use fluoride gels and rinses. But that also, I will say, never introduce anything of this sort just by seeing the advertisement or just by listening through someone else. No, always do it under the prescription and under the guidance of your pedodontist. Okay. Now, another thing is that I'm asked about is, should we use chemotherapeutic agents? That means, should we use mouthwashes in our child? No. Please no. This is a very, very big misconception that to keep the children's teeth clean, or for adults also, we should use mouthwashes on regular basis. This is extremely wrong. Mouthwashes have their own side effects. If you want, I can elaborate a video about that, the side effects of mouthwash, and in what situation should a mouthwash be used. But in this age group, if we talk about specifically, mouthwashes are not recommended. So please, I'm a pedodontist myself. Whoever says so, please do not follow it blindly. Do your own research. Take a second opinion. Do not use mouthwash in children of this age. Okay. So that's it. If you want, I can make a video separately on mouthwashes, when they are to be used, what are the side effects of using it on your own regularly for a longer period of time, all that. Do let me know in the in the comment box. And that's it. Thank you. I hope it was useful for you. Take care.